Good morning. I decided to do my recorded post on HIV. My other two posts were on herpes and genital warts. So here it is. HIV is transmitted through the blood and other bodily fluids. It's mostly through sexual contact and sexual activity. However, there are other ways that a person can contract HIV, such as through blood transfusions. Um, that's like something that they have a barrier for testing now, but when HIV first came onto the scene or was discovered, it was very possible for a person to donate blood without realizing that they were infected with HIV, therefore passing along that virus to somebody who was in need of blood products. Um, you can also contract HIV from working in healthcare, being infected, being injected by a needle, accidentally being stuck, sticking yourself with a needle that's been used on an infected patient. One myth about HIV that has been debunked since the beginning is that you can get it from drinking after someone who has HIV, and that is not the case. HIV virus does not live in saliva. Um, I don't know how it got debunked, but it did. Some people also think that just from touching somebody with HIV that you can contract it, but that's also just a myth and has been proven to not be true. The prevalence of the HIV virus is uh, more prevalent in um, gay males. Um, that is said to be because of if they have anal sex, the participation in the anal sex where it rips um, the person's mucosa in their anus, and the semen and the blood mixture makes them more prevalent to um, contracting HIV if one or the other already has it. It's also more prevalent in African American and Hispanic gay males than in white men. Um, HIV greatly affects the body's ability to fight off infection and can eventually um, lead to AIDS. Children who are born to HIV positive, um, HIV positive mother does have a small percentage or ability to be able to contract HIV, but the uh, the prevalence of children being born with it is very low. Um, in the United States, the second most affected population behind African Americans for HIV is the Hispanic community. It's not really known why that is, besides some Hispanic populations have the lack of um, health care. A lot of Hispanic and Black people don't go to the doctor to have screenings to even be tested for it. So it tends to spread a lot more in those communities. In my research, I found that the southern parts of the United States are more heavily saturated with HIV, newly HIV diagnoses. In fact, half of the new diagnoses are from the southern parts of the United States. If we want to speak about ethics, ethically speaking, despite the large stigma surrounding HIV, the nurse should be careful not to discriminate against the patient and the patient's partner, spouse, um, because you want to make sure that you're treating everybody with the same respect and humility that you would from somebody who's not diagnosed with HIV. I mean, just because a person's diagnosed with HIV doesn't mean that they should be treated any different. You should be taking the steps to make sure that you are advocating for your HIV positive patients the same as you would for a patient who is not diagnosed with HIV. And legally speaking, the nurse has a duty to report any new diagnosis to the state health department of anybody who's been newly diagnosed with HIV. The AACN Essential 4.1 states to disseminate one scholarship to diverse audiences using a variety of approaches or modalities. So this is like what we're doing now is we're just spreading knowledge about HIV or whatever STI that you decided to cover this week, and we're using a different mode of communication to do it, which is this video. Thanks.